Most patients who walk into my clinic have had at least one cortisone injection in their knee. Some have had 3, some have had 10, and almost every one of them tells me the same story. The first one felt like a miracle. The second one was good. The third one, less. The fourth, barely. The fifth, they had stopped counting. This is one of the most common patient experiences in orthopedics. The relief is real at first, and then it shrinks, and then it disappears. What I want to do today is explain why. Because once you understand where a cortisone injection actually goes and where the damage in an arthritic knee actually lives, that disappearing relief pattern stops being a mystery. It is exactly what should be expected. The relief is real. The problem is where it stops. Let me start by saying something many doctors will not say out loud. Cortisone, when it works, really works. It is one of the most powerful anti-inflammatory medicines ever discovered. When it is placed into a swollen joint, it can calm that swelling within days. The fluid drops, the heat drops, the pain for a while drops. If you have had this experience, you are not imagining it. The medicine does what it claims to do on the day it is injected. The problem is not whether the injection has an effect. The problem is what the injection has an effect on and what it cannot reach at all. When a doctor injects a cortisone into a knee, the needle is placed into the joint space. This is the gap between the bones, the space where the lubricating fluid sits. That is where the injection goes. The medicine spreads through that fluid. It calms the lining of the joint. It calms inflammation sitting in the joint space. But as we discussed in our last video, the damage in an arthritic knee is often not sitting in the joint space at all. The damage is in the bone underneath, in the lesions inside the bone, in the structures the needle never touches. The cortisone is delivered into the room. The damage is happening in the basement. The injection cannot reach the basement. The needle stops at the joint. The damage does not. Some patients hear this and think, well, even if the injection does not fix everything, surely repeated rounds are at least helping with the pain over time. That assumption was tested in a randomized trial published in one of the world's leading medical journals. Patients with knee arthritis were given a cortisone injection once every 3 months for 2 years. Another group on the same schedule received an injection of salt water instead. Neither the patients nor the doctors knew which group anyone was in. At the end of 2 years, the cortisone group did not have better pain than the salt water group. The repeated injections had not delivered any pain benefit over doing nothing. And there was a second finding. The cortisone group had lost more cartilage than the salt water group, roughly twice as much on average measured on MRI. This is not a fringe study. It is published, peer-reviewed, randomized, the highest tier of evidence we have in medicine. What it tells us is that the short-term relief from a cortisone injection is exactly what it appears to be, short-term. And that repeating it does not buy the patient anything in the long term. If anything, it costs them something. So now go back to what most of my patients describe. The first injection, months of relief. The second, weeks. The third, days. And then a point where the patient says, I am not sure it does anything anymore. This is not a coincidence. It is not a personal failing. It is not your body becoming resistant to the medicine. It is what target mismatch looks like over time. When you treat the joint space and the actual disease is being driven from the bone underneath, the inflammation from the joint comes back because the source is still there, untreated. Each round of cortisone calms a smaller fraction of an unfixed problem until eventually it calms nothing at all. The target is wrong. The curve always bends the same way. So if the joint space is the wrong target for a knee that is being driven from underneath, what is the right target? The right target is exactly where the damage is being generated, the bone underneath the lesions, and the metabolic conditions that are feeding inflammation upstream of the joint in the first place. That is the approach PRASAD is built around. It begins by addressing the metabolic environment that allows the disease to start, and it delivers biological repair where the damage actually lives, not just into the joint space, but into the bone where the lesion sits. The full reasoning behind that protocol is in our April 12th video linked below. The longer explanation of the bone marrow lesion itself, why the foundation matters, is in last Sunday's video also linked below. If you're being offered another cortisone injection and you've already had a few, there is one question worth asking before you accept. Where is the injection actually going? And is that where the damage actually is? If the honest answer is that the injection goes into the joint and the damage is in the bone underneath, then another round of cortisone is not the next logical step in treating you. It is the same step repeated on a target the medicine cannot reach. Ask the question no one asks before the injection. Where is it actually going? I am Dr. A.K. Venkatachalam from the Madras Joint Rejuvenation Center. Contact details are available in the description.